السلام عليكم ورحمة الله وبركاته. Extraocular muscles and cranial nerve 3 and 4 and 6. First of all, we have to identify that we have six muscles named extraocular muscle. Extra means outside, ocular, outside the eyeball, outside the eyeball, ocular muscles. We have six muscles. Four muscles named rectus. Rectus means straight, originating from the back of the eyeball around the optic foramen and inserted in the outer coat of the eyeball named sclera. We have four rectus, يعني superior rectus from above, inferior rectus, and medial rectus, and inferior rectus. But we have two muscles not straight. It is originating also from the medial and the floor of the orbit and runs oblique to be inserted also in the sclera, but runs oblique, so it is named oblique muscle. We have two oblique muscle, superior oblique and inferior oblique. All these muscles, very, very important, all these muscles supplied by a nerve number 3, oculomotor nerve, except SO4 and LR6. What means by SO4? يعني superior oblique muscle, this one, not supplied by oculomotor, but supplied by number 4 trochlear nerve. And LR6 يعني the lateral rectus, this is lateral rectus, supplied by number 6 abducent nerve. So we have three nerve motor to the muscle of the eyeball. Three nerve motor. Number 3 and the number 4 and the number 6. All these supplied by 3 except superior oblique by 4 and LR يعني lateral rectus by number 6 اللي هو الابدوسنت nerve. طيب, what's the action of these muscles? If you have here, this is the nose, and this is the right eye. This is the right eye. What is the movement of the eyeball? Any movement up, يعني elevation of the eyeball, move the eyeball up, it is named elevation. The opposite of elevation, down, depression, movement of the eyeball down, movement medially toward the nose, it is named adduction, and movement laterally away from the nose, it is named abduction, and movement with clockwise, it is named intorsion, and the movement anti-clockwise named extorsion. Also here we have intorsion, and the opposite here is extorsion. You have to memorize this perfect. يبقى again elevations here. طيب, يعني move up, move down, depression, toward the nose adduction, outside or away from the nose abduction, and في intorsion يعني clockwise, and the opposite of intorsion اسمها intorsion, and the opposite of intorsion extorsion. طيب, what are the muscles that produce this movement? Please, starting from the nose, here you can write, this is the superior rectus, this is the medial rectus, this is the inferior rectus. And away, this is the lateral rectus, the opposite of medial rectus, lateral rectus, the opposite of superior oblique here, Superior rectus will be superior oblique. This is action, not the origin or insertion. This is the action. And the opposite of inferior rectus, it is inferior oblique. So if I ask you about what are the muscles move the eyeball up? What are the muscle moving the eyeball up? So will be superior rectus and inferior oblique. طب what are the muscles moving the eyeball down? Will be inferior rectus, huh? So the arrow, and inferior oblique. So superior oblique. طب intorsion, superior. Extorsion, inferior. طيب adduction will be superior rectus and the main power by medial rectus and also inferior rectus. This is adduction. Abduction will be inferior oblique and lateral rectus and superior oblique. طيب. From this also you can detect the action of the superior rectus alone. The superior rectus moving the eyeball up and in لجوه والفوق up and in. The superior inferior oblique moving the eye up and out. Inferior rectus moving the eyeball down and in. Superior oblique moving the eyeball down and out. And the eyeball balanced by this muscle. So if any weakness of medial rectus, for example, the there is a weakness, the eyeball is balanced by medial and the lateral rectus. So any weakness of the medial rectus, the eyeball will moving toward the lateral rectus. And also the opposite, weakness of the medial of the lateral rectus, the eyeball will moving toward the medial rectus. So this named squint, howl. And also if the eyeball move up and in by superior rectus, so the superior oblique is weak. لو الايبول moving down and out here, so the opposite of the superior oblique, superior rectus, so we have a paralysis of superior rectus. This is regarding to the action of this muscle and its nerve supply. طيب يبقى so if the eyeball moving in, this is the nose, moving here, eyeball moving here, يبقى superior rectus. Eyeball moving here, up and out, inferior oblique, down and out, superior oblique, down and in, superior inferior rectus, medially only, medial rectus, laterally only, يبقى lateral rectus. So this is regarding to the action. What about these muscles? The nerve supply of the muscles. We have three nerves. Nerve number 3, oculomotor, and the nerve number 4, trochlear, and we're having nerve number 6, abducent. If we want to discuss these nerves, what is the origin of these nerves? The oculomotor from the midbrain from the front in the interpeduncular fossa, if we remember. From the dorsal surface of the midbrain, the only nerve arising from the dorsal surface will be trochlear of midbrain. And the abducent is originating from between the pons and the medulla. Right. This is number 1. Number 2, you have to remember any of them are 1973. Only number 3, 1973. So number 3 have 2 fiber. One fiber is motor, have motor nucleus, and one fiber is parasympathetic, have a parasympathetic nucleus. What is a parasympathetic nucleus of oculomotor? It is named Edinger Westphal nucleus, which release the fiber in oculomotor and go to the ciliary ganglia, if you remember. Ciliary ganglia. So the ganglia of number 3 is ciliary, and give muscle, parasympathetic muscle, to the muscle named sphincter pupilli muscle, or constrictor pupilli muscle, which constrict the pupil, and also ciliary muscle, which adapt the size of the lens. Again, the only nerve which has have the both fiber, motor and the parasympathetic motor nucleus, and parasympathetic nucleus, it is named Edinger-Westphal nucleus, and send the fiber to the ciliary ganglia. This parasympathetic supply to muscle important involuntary اللي هي ciliary muscle for accommodation, and the sphincter pupilli muscle for constriction of the pupil, and very important in light reflex. Here only motor. Here only motor. طيب. If we remember before the cavernous sinus, what are the content of the cavernous sinus? So the lateral wall, it is otom, oculomotor trochlear. So it runs in the lateral wall of cavernous sinus, lateral wall of cavernous sinus, and but here abducent in the floor of cavernous sinus related to the internal carotid. After that, number 3 and 4 runs between Becca and Sacca. Here also between Becca and Sacca. But here, and all of them enter the orbit through superior orbital fissure. Superior orbital fissure and superior orbital fissure. طيب, what is the nerve supply of number 4? Will be superior oblique only. What is the nerve supply of number 6? Lateral rectus only. طب what is the supply of the number 3? All the muscle except superior oblique and the lateral rectus. يعني supply medial rectus, inferior rectus, superior rectus, and inferior oblique, plus sphincter pupilli, plus الsphincter pupilli muscle, plus inferior sphincter pupilli muscle and ciliary muscle. Again, again. يبقى نمبر هنا sphincter pupilli and ciliary muscle, and plus sublime muscles very important in the eyelid. What is the name of this muscle? Levator palpebri superioris. levator يعني elevate, palpebri يعني eyelid, superioris يعني upper eyelid. Very important in elevation of the upper eyelid. This is regarding to the supply of each one. What is the lesion? The lateral rectus move the eye laterally. So any lesions of number 6, the eye will move medially. So it is named the medial squint. حول داخلي. What is the movement of the superior oblique? Moving the eyeball down and out. So the eye will be directed up and in lesion. And very important in the patient complaining of difficulty downstairs, مش عارف يمشي هنا, or difficulty in looking to the box or reading the box or looking to the shoulder. What is the lesion of the oculomotor? Oculomotor, the most common lesions, it is lateral squint, because the medial rectus is a lesion. So the eye is directed out, this is lateral squint. And the levator palpebri superioris, which elevate the eyelid. So the eyelid will be ptosis. And very important to remember that the ptosis, it is complete ptosis, must be complete ptosis. And finally, the sphincter pupilli muscle and the light reflex will be loss. So loss of the light reflex, and the pupil will be dilated. So it is named the mydriasis, dilated pupil. This is regarding to the nerves and the lesion of the nerve. Again, and this is a muscle. This is here superior rectus, inferior medial lateral, and the two oblique. This one is superior rectus, inferior rectus, medial rectus, lateral rectus, and the two oblique. This is regarding to the eyeball movement, and out, up and out, down and out only, medially only medial rectus, up and in superior rectus, down and in inferior rectus. Regarding to the nerve, oculomotor nerve, as we said, motor nucleus and Edinger-Westphal nucleus from the midbrain through back and sac and superior orbital fissure, lateral wall of cavernous sinus, and supply all the muscles and also sphincter pupillae. So هنا الليجن شفتوا السكوينت ها الاي directed down and out, so the action here is superior oblique and the paralysis here in the superior rectus, the object. The eye lid is down, so ptosis. And the pupil here dilated, so it is dilated pupil mydriasis. So these lesions of oculomotor nerve lesion. The same of trochlear nerve. And here the lesion of trochlear nerve. Here the eye is directed up and in. So the action here by superior rectus. So the opposite of superior rectus is superior oblique. So we have here superior oblique lesion. What's the nerve supply of superior oblique? Trochlear nerve. Lateral abducent nerve from cavernous sinus. Here the eyeball is directed medially. So action by medial rectus, so the lateral rectus will be lesion. So it is a lateral rectus supplied by abducent nerve. Thank you so much.